You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Southern California's go-to implant dentist, Dr. Ron Ayzin. Dr. Ayzin, welcome to the program.
Thank you for having me. I appreciate it, Randy.
Now, I know you brought a stack of photos, so I'll get to as many of those as possible. Now, for those people that don't know your implant practice, like who's the typical dental implant patient?
I would say our typical dental implant patient is not typical. We have all sorts of patients varying from all different backgrounds of life, but a lot of our patients kind of fall into two categories.
Okay.
One category are the patients that have maybe gum disease, loose teeth. They're losing one tooth by one tooth, and they're starting to see an effect of those missing teeth. And those patients are afraid they're going to be in dentures or end up in dentures,
okay,
or they might not end up having teeth at all. And
do they feel like they're going to end up in a denture, you say?
they feel like they're going to end up in a denture. And
That's why they go to you guys.
and they come to us. And then our other type of patient are the patients that already have dentures. They're loose, they can barely eat, they can barely chew, and maybe they've been told in the past that they don't have enough bone to get a full set of teeth or dental implants, and those are our patients that come to us.
So the denture wearers. But isn't it true if you've been wearing a denture for, let's say, 10 or 15 years, you can't do this, you don't have enough bone?
That's absolutely not true. Today's modern dental technology, new practices, new techniques, and new dental implants, we can give patients a new set of teeth.
Okay, good. Now, we should mention your background. I guess most people in your family are dentists.
I would say we have a huge dental family. I'm actually a fourth generation dentist. My dad's a dentist. My grandmother was a dentist. My great-grandfather was a dentist.
Is that right?
And we have a bunch of cousins and uncles in here. Pretty much born to do this.
Now, correct me if I'm wrong here. The way dental implants are typically done is you go to one doctor that does the surgery, and then you go to another doctor that puts the teeth on top, and then you get them maintained elsewhere. At your office, I guess you do all three parts.
So that was the old way of thinking, the old way of doing it. And I found that bringing all those things under one roof, putting the dental implants in, restoring the teeth, giving the patient those new set of teeth, and then maintaining those teeth, keeping them healthy, keeping them clean, all under one roof with the same doctor, really allows us to give us the best end result for our patients.
Now, we talked in the green room. You say, in a perfect world, okay, that somebody watching this right now with really bad teeth and gums or even a denture, if you had room in your schedule, like in 3 days from now, they could have their upper and lower new teeth.
Absolutely.
Is that possible?
Within a week, if patients are ready to do it, and we have the time in the appointment in the calendar book, we can get patients in with a brand new set of teeth, waking up, ready to go.
Is that right? And now, of course, you're a dentist. You think the smile is like the most important thing, probably. How important is it?
Well, Randy, it's not because I'm a dentist that I think the smile is so important. It's what people see. Most people, the smile is one of the top 3 most important things to them. In fact, in Men's Health, they have a survey, multiple surveys now, and each and every time they ask what is the most important thing in a person's appearance. And smile is always in the top 3. Take 2 twin sisters. They're both about to go on a job interview. One is bothered by her gap. She hides her smile, never smiles. When she talks, she's covering her teeth. And the other twin sister, she doesn't care. It's part of her personality.
So they both have gaps in their front teeth.
They both got gaps.
Okay.
Second sister has a lot of confidence. She's still smiling, comes bubbly to the interview. Who do you think the person's going to get hired? The one that's smiling. When you show a smile,
good point.
You're welcoming, you bring in a nice energy to the office. The one that is smiling is going to get the interview.
So you don't necessarily hire the one with the prettier smile, but if one is confident or has more charisma, I guess.
The one that is more welcoming, is friendlier, giving a smile, even though they have the exact same teeth. The one that just has a friendlier look to her, and what is friendly to us is a smile. That one is going to be the one that's going to get hired.
You say people with bad teeth are judged.
They feel that people are looking at them, looking down at them.
They tell you that?
They tell me that.
Okay.
Patients tell me that they feel that they're being judged for their smile. They were worried about coming to my office. They thought I would be judging them for their bad teeth. They were worried about their bad breath. They're worried about going to their family events, and now they can't even smile or talk because they're worried that people are smelling them.
Is that right? You say some people say they never smile.
It's sad
Like
to
in
hear.
photos or anything like that?
It's sad to hear. I have many patients before coming to me, they say they never smiled. I have a patient for the last 25 years. He said he didn't smile. He told me he didn't know how to smile anymore. Once we fixed his teeth, he's like, I have to learn how to smile again. He's like, I don't know how. He's like, I still feel awkward. And I tell him he looks great.
Now, you know, and we were talking about, you know, in Hollywood and the movies, I guess there are dentists that actually make fake bad-looking teeth to make somebody look like a street person or homeless or whatever, or a villain.
Yeah. Because in Hollywood, they understand that we associate bad teeth sometimes with a bad character. They make the villain have bad teeth. They make them have yellow teeth because they want to make them look like someone that we don't want to associate with. We associate people with a nice smile as the hero in Hollywood.
Okay.
We want to have the hero have that beautiful, nice, white smile ready to go. Let me tell you what I've seen from my own experience.
Okay.
We fix people's smiles and they come back and they are brand new people. They're confident.
Brand
they're
new?
Loud, they're confident. They're loud. They walk into a room with an air to them, with an almost swagger. As they walk into a room, they are ready to go. They just bring a new energy that I did not see before. They are happier. They're smiling. And they just showed themselves as a nice, confident person. And what's more attractive than confidence?
Now, whenever you're with a patient, right, they come in to you and they tell you their hard luck story, how bad their teeth are. Do you ever get excited thinking they have no idea how good this is going to be? Like in your mind on the consult?
A lot of times I'll see a patient and I just see a beautiful blank canvas. And I know that at the end, when we give them their brand new teeth and their new smile, I can't wait to see when they first see their new smile because they almost lose it every time.
How old can you be? Like, what's the oldest age range somebody could get dental implants?
Why wouldn't a 90-year-old want to do this? Because they can eat, they can chew.
Okay,
they can finally go to their family's events and not worry about taking their teeth out. You get to eat and enjoy dinner with your family and friends.
So you did a 90-year-old.
So far my oldest patient's 92-year-old.
Okay.
We've done dental implants for them, gave them a full set of teeth on the upper, and if it wasn't for those dental implants, they'd be stuck with a denture. Now with dental implants and a full set of arch of teeth, they can eat, they can chew, they're going to their family events, and they're really enjoying life.
So age doesn't matter. They're not more likely to fall out. Yeah, but what if you have bad gums, like gum disease? Can you do this?
That's what most of our patients are. Most of our patients have bad gum disease.
Okay.
And this is the perfect solution for them.
Why?
Because now we take out those bad teeth causing the gum disease, we put in a new set of implants instead of teeth, and now they're healthier. We've gotten rid of that bacterial infection in their mouth.
That's nice.
And finally, they can eat.
Okay, good. You brought photos. What are we looking at over there?
Absolutely. I got plenty of awesome before and afters.
Okay.
Let's start off with Roberto over here. Take a look. When you hear his story and see his after, you'll be amazed.
All right.
He's an Italian chef, moved here from Italy, and back when he was a kid in Italy, dental health wasn't the most important thing. He was losing one tooth by one tooth. As he was getting older, he started to find out that his teeth were getting looser, and he started to feel that he wasn't going to have teeth. He was worried about being stuck in a denture.
All right.
Fast forward, he walked into my office. He had a very ill-fitting partial on the upper, on the lower teeth. His canines were loose. He could barely chew. They were swaying back and forth in his mouth. And he's a chef. He can't even eat his own amazing creation.
He tells you this?
He did.
Okay.
I've been in his restaurant, not his office. I've been in his restaurant, amazing Italian food. And he can't even try his own food half the time because he can't even chew on it.
So what did you do for him?
We did a brand new upper and lower set of teeth supported by dental implants.
Okay.
And he's now finally able to eat, chew, do whatever he likes to do. And he loves to cook. And he needs to try his food so he can make sure that we like it. I love going to his restaurant, and he welcomes me in, big, nice smile, and he's a very nice Italian man. And he welcomes me in, and all of his patrons, he gets to see what it's like. Take a look at the before and after.
It's nice.
Before, he was faking that smile. You can kind of see he's trying to really force that smile. Now look at the after. He can't stop. He can't hide that smile. He can't hide that energy. Looks a little younger, looks more successful, looks happier. He's welcoming. This is
more handsome, too.
More handsome. So this is a successful guy now.
You say teeth change people's appearance. You believe that?
Teeth do change people's appearances. Take a look. It's obvious.
Yeah, that's right. That's right.
Take a look at the next guy. We got John over here.
All right.
He's got an awesome story. He's a veteran, served our country, and he told me he had a smile for 30 years. He was born with missing teeth, and he ended up getting a bacterial infection. He was losing tooth by tooth, and he was going towards the route of a denture. We were able to
Did they tell you that? Like, I don't want a denture?
Yes.
Well, that's probably why they go to you
He was like, I don't want a denture. He said he wants real teeth. He wants to be able to smile and not take his teeth out. We ended up being able to save his lower teeth, but on the upper, instead of having a denture, we were able to give him a new set of teeth supported by dental implants.
Wow, it looks good.
And by removing the bacterial infection, his story is amazing. He had a very large bacterial infection, especially in the upper and in the back, affecting his sinuses. He told me after doing his surgery, he wakes up better rested, sleeps well. He tells me he doesn't snore as much anymore. He literally says he sleeps and breathes better because we finally gotten rid of infection that he's had to deal with for the last 20 so odd years.
So when people like this look at their face in the mirror for the first time, or their new teeth for the first time, what's that like?
When they first see their new smile or their new face in the mirror for the first time, it's jaw-dropping. It's dramatic.
Do they get choked up sometimes?
Some patients choke up. Some patients tear up. Some patients even cry. Some laugh because they can't believe they've been waiting so long to do this. They're like, who is that? A lot of them say they're looking into the past. They feel like they look like their old version of themselves, the younger version of themselves. And they feel like we've brought them back to what they used to look like, and they couldn't be happier.
Now, what could this guy eat now? I mean, could he bite things like a steak with his front teeth or like a carrot with his front teeth?
John's biting into apples. John's eating steaks, hamburgers, sandwiches, carrots, salads. He's finally eating healthier now. Look at his face. He's lost weight in his face. And it's because he's got teeth that are strong enough to eat real food. He doesn't have to eat the processed foods anymore. He can have a nice salad. He can have a nice burger, a nice steak. He's eating healthier, and having that change in his teeth has affected his entire health.
And maintenance. I mean, they just go to the dentist like regular teeth,
He
right?
comes to our office just like regular teeth. We do his dental cleanings. We do his checkups every year. And I get to see him all the time.
People don't like going to the dentist. You probably still hear that. Do you ever hear that?
I hear
no
that.
offense, doctor.
I hear that all the time. I take no offense because patients have had that experience in the past. My goal is to change people's perceptions going to the dentist. I want to make patients happy, comfortable. They're not scared anymore. And now my patients, they come in, they're not worried about having that dental infection in their mouth. They're not worried about being judged by other people, friends or family. They come to our office, they're coming for a cleaning. We just get to know each other, get to see what's changed, what's going on in their lives. Patients are comfortable coming in and they're happy.
Now, you're in Orange County, California, but you draw from a big area. And it seems like people in Orange County are very healthy. I mean, are there denture wearers
There
in
are
Orange County?
so many people with missing teeth, especially in Orange County and SoCal. There are hundreds of thousands, if not even more people wearing dentures in Orange County. And we are here to help them.
So do you think now, and we were talking about there's like in America, there's supposedly, I Googled it, 30 million people with an upper or lower denture. There's only about 300,000 dentists. So if they all figured out how good this is, there's not even enough dentists to handle this. Is there some truth to that?
There is absolute truth to that. There are maybe not enough dentists to take care of everybody, but we're here to help as many people as we can.
So is this the future as you see it? Like, let's say 20 or 50 years from now, dentures as we know them today won't exist. They'll all be attached to something.
That's my goal.
Do you believe that?
My goal is to get every patient that either will need or already has a denture to have teeth that are stuck in their mouth that they can wake up with.
What about pain? I mean, this must come up. The fear of pain. Seems painful.
Number one, they can't feel any pain. All the patients are numbed up. Most of them are sedated. And when they wake up, they are ready to go. They are surprised at how easy the recovery process is. Many of my patients tell me they experienced no post-op pain as well. They're super happy and surprised at how easy the whole thing was.
So you offer what type of sedation? Like are typically these people getting?
Yeah, we offer local anesthetic. We offer oral sedation, IV sedation for patients. Whatever makes patients most comfortable, we want to make sure that we can bring that to our patients.
So IV sedation is typically how you're doing it. So is this true? They almost have like no memory of getting it done?
A lot of the patients say they wake up and they're like, wow, I have new teeth.
Okay. And now what do you monitor? Let's talk about safety on sedation.
Absolutely. We have an anesthesiologist come on in for most of our cases.
Okay.
And we're monitoring their labs, their heart rate, blood pressure. We're making sure that everything is under control.
Now, patients, because you're saying like 80-year-olds are doing this, 90-year-olds are doing this. Most of these people are on like, statistically, 5 or 6 medications. Can you be on like osteoporosis or blood thinners and still get this done?
You absolutely can. As long as we know ahead of time all the medications that you're taking, we can take the proper precautions to make sure that everything is done properly.
Do you ever have to talk to their medical doctor?
Almost always. We want to talk to your medical doctor, to your physician, to make sure we know your full history. Go ahead and take a look at Carmen next.
Okay.
She's an amazing lady. She had an upper partial denture and a lower full denture. She was so embarrassed going to her family events, and she's a big family lady.
Okay.
She hated going to her family events because she had to schedule when she would take her dentures out. She didn't want to take out her dentures in front of her grandkids. She
told you this on the consult.
She literally told me 5 o'clock she planned on taking out her dentures so she could eat, and then put them back in when she was hanging out with the grandkids again. I can't believe having to schedule when I would take my teeth out when a patient has to take their teeth out just to hang out with their family. She probably, if going somewhere else, would have lost the rest of her front teeth. They probably would have ripped them out, given her a full denture. Not with me.
So what'd you do?
We were able to have an awesome result with Carmen. We ended up saving most of her upper teeth. We did veneers to make them look beautiful. We added a few dental implants to replace the missing teeth and to get rid of that partial denture. And on the lower, we put a brand new full set of teeth supported by dental implants. Now she's chewing, eating, smiling, hanging out with the family, and she's not scheduling when to take out her teeth with the grandkids. Look at the after photo. Notice how the teeth are following the lip line. They're brighter, they're fuller, they're not coming out from the upper left as you can see on her before. She's got a full set of teeth, a nice smile. Look at her. She looks younger, she looks happier, looks a little brighter.
So at your office, you just don't do one thing. Like I think you said when we were talking about it in the green room, that some of these patients, they just remove all the teeth. Places only do one thing. You try to save teeth whenever possible. Can you expand on that a little bit?
My goal as a dentist, when the teeth are salvageable, we want to save them.
Okay.
If patients' teeth are healthy enough, we want to keep them. If not, we have beautiful options to take care of that.
Okay, good.
We want to be able to bring whatever the patient actually needs. That's what we want to do for patients.
So at the top of the show, we said no more dentures. So you believe that? And she would have been in a denture.
Most patients aren't happy with dentures. They don't want to take their teeth out at night. They don't want to wake up and put their teeth back in. They don't want their teeth moving around, shuffling around. They want to be able to eat harder, real foods. Dental implants give us that ability.
I know a couple of denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer?
Randy, that's because you're not a dentist. Why would they talk to you about their dentures?
Yeah.
Of course they're not happy with it. If they had the option to be able to have teeth that get to stay in their mouth, stay in their heads, and they can sleep and eat with them, why would they not do that? Randy, let me tell you something. Most of my patients, if not every single one of them, tells me that they waited too long. They were kicking themselves for not doing this sooner. They wish they had done this earlier.
Like a patient like this, how many years did she not like her teeth?
15, maybe 20 years before finally doing it. She lost out on 15 years of having a beautiful smile, being able to eat, and not worry about talking to her grandkids anymore. Patients like this could not be happier that they finally did it. And what was holding them back was a variety of things. If they just come into the office, we can find out what's holding them back and bring them to a new set of teeth.
Do they get to meet you on the consultation?
Patients get to meet me. Patients talk to me. We figure out what the right solution for them is. Each solution is customized to each patient depending on the case, and we find out what's the best move for them.
Okay, good. So, a few more photos.
Absolutely. Take a look at this guy. This is Bernard. He's over 90 years old. I think he's 92 now.
Wow.
And he's got a beautiful story. He's got a high school sweetheart, been married for over 72 years, one of the most beautiful love stories I've ever seen. He was finally ready to have a set of teeth. He had dentures on the upper that he was sick of. He was tired of taking them out, tired of not being able to eat. He said his wife didn't care how he looked, but he was tired of not being able to eat and chew. He said she's a great chef, great cook, and he wanted to be able to eat her cooking. And so we finally delivered that for him. We gave him a brand new set of teeth supported by dental implants, and now look at him. He's happy guy, looks great.
And they look natural, too.
And they look natural. They fit his face. We want our teeth to look natural. We don't want patients or people or your friends or your family to think, do you have new implants? No, we want people to think that you have a brand, like what's new about you? You have a nice smile.
So, guy 92 obviously has some wisdom about him. What does he say when it's all done? Like, what are some of his comments?
I think Bernard's main comment is that he just finally feels like himself. He finally can walk into a room. He's able to just live his normal life. And I think the biggest change for him is that he doesn't have to worry about his teeth coming out. He can actually eat. Bernard's 92. He's retired, nice, healthy guy, but he travels. He wants to be able to try the local cuisine. Now he can. He doesn't have to worry about what he can eat. Go ahead and take a look at Rick. Rick here is a truck driver. His option was a denture. He didn't want that. He wanted to be able to chew and eat. And he was honestly, with his old set of teeth, he's kind of quiet, wasn't showing his personality. I saw him a couple months later after his surgery. This guy's as loud as can be. He's got so much personality, I can't believe he's behind a truck. I feel like he should be on TV somewhere. But now with his new set of teeth, he's able to smile and his personality shows.
So some of the work is done with the lab on the computer. Like, how do you make the teeth fit his face? Because you mentioned that a couple of times.
Absolutely. Well, we do a little bit of team effort between me and the patient. We decide what they want to look like, maybe what kind of smile they like. Maybe we'll see some old photos of them, decide what they used to look like, see what's best for them. And with my master lab technician, we fit the teeth to the face. We want to make sure that the smile looks good for each patient. All right, take a look at Paul here.
All right.
Paul had an old denture that he hated. The slipping out of his mouth.
Is that an upper denture? Because he doesn't even show his upper teeth.
He doesn't show his upper teeth at all. He wore the denture down so much because it wasn't fit properly for him. It was falling out every time he'd talk even. He couldn't smile because it popped the thing right out. Well, we did an upper new set of teeth supported by dental implants. And look at him. He's got a full smile
Looking
again.
good. He looks good.
Look at that after photo. He looks younger. He looks happier. His eyes light up just a bit more. And he's now able to eat. His teeth aren't falling out when he talks and chews. He's a happy guy.
Do you think people just don't know about this?
I just don't think
more people would do it.
realize what their options are.
And how easy it could be?
It can be so easy. Patients finally find out how easy it is to get a new set of teeth once they know their options.
Do spouses ever come in? Like one goes first, second one comes second? Are you seeing more of that?
We have. Actually, I've had a couple patients come in, husband and wife together. They're ready to change their lives together. I think some patients find it a little easier if they have that teammate alongside them.
Now, some of these patients will give you credit and they'll say you changed their life.
We didn't change their lives, they changed their lives.
Okay.
And they finally decided to make that step, coming into the office and making a change.
And doing something about it. I guess that's the hard part. Okay, time for a couple more. I'm going to rush you.
Yep. All right, go ahead and take a look at Edith over here. Edith looks great, and her family could not be happier. She always tells me that these are her old teeth. She lost her teeth when she was younger, working as a nurse. She had bacterial infection in her mouth, ended up losing her teeth, and then she had let the years go by missing teeth. Now she's got a brand new set of teeth, and her family keeps telling her that she looks just like how she did when she was a young girl.
Very nice.
And she looks beautiful now.
Now we have to bring up the cost. I guess Medicare doesn't cover this. Medicaid definitely doesn't cover this. And even the best insurance doesn't really cover this.
Yeah, but Randy, most of our patients are financing this.
Okay.
We work with many different lenders that work with patients to make sure that they get financing. 80% of patients across the country are now financing these kind of procedures. And we work with patients to make sure that they can afford this.
Okay, now we didn't talk about this, and I'm rushing because I know we have about a minute left, but there's snap-in, snap-out teeth supported on implants, and then there's the fixed teeth that don't come out. And even though you do the snap-in, snap-out, I don't want to put words in your mouth here, but you're not a big fan of those snap-in, snap-out.
I'm not a fan of the snap-in, snap-out dentures because patients don't like them.
Okay.
At the end of the day, it's still a denture. Patients still have to take their teeth out at night, and they don't sleep with these teeth. They still work better than a regular denture, absolutely, but it's still a denture, and patients don't get to have that feel of real teeth. They don't get to sleep with them. They may not be able to eat as hard of foods, and they might not look as great as a full new set of teeth.
Now you were telling me, like the new dentists that are new in the implant business, that they start out with a snap in, snap out, and then once they start doing fixed teeth, teeth that don't come out, they like vow to not do the other type. Is there truth to that?
It's absolutely true, because patients are happier with a fixed set of teeth. When teeth are in their mouth, they're so much happier. They feel more like themselves. They don't feel like they have some foreign set of plastic in their mouth.
So what do they like more, the way their new teeth look or the fact that they can eat anything they want now?
Some patients want to be able to eat. Some patients care more about the look. I say, why not have both? Our goal is to have patients be able to eat whatever they want and look the way they want. A lot of my patients came in because they had pain, some infection in their mouth, and they wanted to be able to just chew finally. And then they walk out and they couldn't be happier with how they look. They came in with a little more confidence now. So we gave them what they wanted. They made sure that they are happy with how they eat, how they look. But now they're finally able to smile. They're proud of how they look.
So are more men doing this than women, or more women doing it? Because men tend to put things off.
I would say men tend to put things off farther. I would say for this procedure, though, I'm getting an equal amount of men and women.
Is that right?
I'm just finding that the men typically are older because they've been waiting a lot longer. And I'm here to say that patients shouldn't wait anymore. Why not enjoy life, enjoy your teeth, enjoy eating, smiling? No need to wait.
Now, just to recap what you talked about earlier, let's just suppose today's Monday. If you had room on the schedule and everything was right and they were in the rush of their life, they could come in on Monday and get their teeth on Thursday or Friday.
Yeah.
Is that right?
It's true. If there's time in the schedule, I have time, patient has time, you come in Monday, Friday morning, you can have a new set of teeth.
Okay, good. And final message, somebody watching this, they're skeptical. Maybe they're afraid of the dentist. They've heard what you have to say. They're of the two categories. Either they still have teeth, but they're really bad, or the person wearing a denture. They've heard everything, and they're still putting it off or skeptical. What do you say to them?
I say it's time to change. It's time to come on in. Let's find a solution that's right for you, and there is no better time than now.
So like, know your options. It's a free consultation.
It's a free consultation. You get to see what's going on. You get to find out what the best option for you is, and we have many different options for all our patients. Find out the financing options if you need it. And let's get together, work together to change your life.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you,
Appreciate
Randy.
it. Now, if they want to make an appointment, do they go to your website and make the appointment, or do you prefer they call the office?
They can call the office or go to our website to make an appointment, whatever's easier for them.
I got to ask you, how soon can they eat after it's done?
They can eat that day.
Is that right? Okay, good. Thanks again. Appreciate it.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.